Okay, welcome back for the second installment of coronavirus reality here in Texas. I'm about to start this off with a clip. I did cover part of this yesterday, but I did not play the news clip from Channel 11, airing on 6/30/20. So I'll let you watch this clip and decide a few things for yourselves, and I will see you on the other side.
In the Texas Medical Center say there are still thousands of hospital beds available to treat patients after some reformatting of their data. Chris Costa explains why doctors say in order to avoid tapping into those extra beds, we need to be extra careful in our daily lives.
Doctors in the Med Center label our ICU beds in phases. Phase 1 is the base level of ICU beds when we're not in a pandemic. Those are almost full. Still, there are hundreds of beds left in phases 2 and 3 before our hospitals and the staff reach a crisis level.
For the next 2 weeks, we are nowhere close to being in trouble.
Doctors in the medical center say they have a plan if the number of COVID-19 patients in hospital ICUs increases.
Moving into phase 2 is not a bad thing, and that's an expected thing, and hospitals can manage well within that phase 2.
More concerning to doctors is the positivity rate, the percentage of people who test positive for COVID-19 every day. That number keeps climbing. Even though more people are getting tested, more of those people are testing positive.
It shows the concerning growth of the virus in the community, so a real problem.
If the positivity rate keeps climbing, then the number of beds will be a concern.
We're really concerned because even the largest medical city in the world has its limits. We're 4 times more likely to get COVID now than we were back in May and April, and the answer is absolutely yes.
Doctors say the advice is...
Okay, so not a whole lot of clear message on that. I'm hearing some wishy-washiness. We can do a couple of things here. So let's look at what he said. For the next 2 weeks, we are nowhere near being in a crisis. Okay, and so that's interesting, considering that they're saying if the positivity rate continues, we're going to be in trouble, which it has been nothing but continuing for weeks at this point. I want to counter with, and I will touch on this NBC story briefly here, but I'm going to do a video on that later. An NBC story released 7/1/20, and they are speaking. Here's a direct quote from that. To tell you the truth, what concerns me the most is not this week. We're still kind of managing, kind of making it okay. All right. I'm really worried about next week, and that comes from Robert Schwartz, Houston Methodist Chief Innovation Officer. So that's a contradictory statement. Let's go on to a secondary contradictory statement. This is also another high-up healthcare professional, but in research. Let's see. So she says the time to act and the time to be alarmed is when you haven't hit capacity. It's much earlier when you start to see the hospitalizations increase at a very fast rate. She goes on to finish the quote by saying it's time to be alarmed. And that was Lauren Ansel Myers, professor of integrated biology at UT, University of Texas. Now we have 3 statements, 2 of which are diametrically opposed to that first one, and even the first one wasn't very positive. So let's who's correct here, and actually it's somewhere in the middle but closer to the worrisome side. I'm going to open up some statistics here. I have been tracking individual statistics, so let's go back to, this is 5/11. Okay, as you can see, this is a chart. Now this is on Bing. I'm also following on the COVID tracker there. I'm also following the state of Texas Health Department. Texas has its own official, Harris County has its own official numbers and everything. They are fed into this. This is where the source gets all their stuff from, but I have individual links for each one of those. Now I'm going to magnify for a second here. And I want you to take note of this. This is back on 5/11. If you can look at the bottom screen, there's 5/11, and we had 39,864 cases, 869 cases. So let me go ahead and magnify here for a second. Harris County, total of 7,878, and 4,000 active, and 3,000 recovered, 3,016 recovered, fatal. Okay, that's all well and good. Okay, so I'm just going to blow through these charts real fast. Let's see here if I can do this magnified. It won't let me magnify, so hold on. Let me go back. Okay, let me close out there, and we'll do it like slideshow wise. So what you see here is when we go through, I'm going through the days. Now this is not every day. I believe the next one is 5/14. You see 8,416 again, 5,000 so infected, 3,000 so recovered. As you keep going on to trends to hold on, to 520, and then I'm doing this like every couple of days. In 524, we see here in 524 there's 10,000 right there. I'll go ahead and blow that up so you can see it a little quicker. And also notice we're at 54,000 up there for the state. There we go. Active 10,000, 95, 5,000, blah blah blah. Okay, so what I'm trying to establish here is there's a trend. So let's go all the way to look at the big numbers jumping. Just watch those big numbers right over here. Look how they're going up as we just click along. 67, 77, 143 out of the blue there, and 181. 181 was today, 7.2, and the 143 was 627. Now I did skip some days doing it because I was picking up other numbers and stuff, but this is going from 6.9 right there, 6.9. We had 77 beginning of June roughly to 627. Look at that, we doubled it. Now here's the interesting thing. I want you to look at something. The few slides I showed you in the beginning. Let's go back to the beginning really quick because I'm trying to prove a point here. This was predictable. What's happening now, and it actually was predicted by the University of Pittsburgh. They predicted the spike, but that's not what I'm talking about. Let's look at something real quick. We blow up again. Okay, I want you to see something here. So we have total cases, active cases 4,000, and recovered cases 3,000. So let's see. Let's go now. They dropped the ball on some of the recovered cases. They can only report what's being reported, and some of that information is being hoarded, sort of, in order to not get the public all antsy. So I'm going to jump a couple of slides ahead. Hang on. Okay, so we're at active of 4,000 or so, and recovered 3,000. Okay, so let me go back because that's the last one where they were including that. Okay, blow this up. Okay, so here we are. Look at what we're doing. When we're on, this is, hang on, get you the date again. This is 6/3. Okay, so remember we started at 511 and 6.3. Now look at what we have now. Active of 7,000, we had active of 4,000 before, and recovered 5,000, we had recovered around 3,000, okay? You're like, so what? Not too impressive. It went up roughly 3,000, okay? I want you to stop and think for a second. Look at a calendar on your computer if you have it handy. The active cases never went down. The recovered went up by several thousand. So as people recovered, the virus kept infecting people at a constant rate, a constantly increasing rate. Now, just a little bit. Now, remember, 5/11, we had just opened up. So there is a lag time, 2, even sometimes 3 weeks from point of infection to being symptomatic. So the second we opened the doors, not everybody got infected. That didn't work that way. People started going out at 25%. They had to mingle. They had to do everything like that. So I was expecting to see changes around the 1st of June, which we did start to see some changes. And then we opened in 50% and up to 75%. But I want you to think about this for a second. Every single day between 5/11 and this date, which was 6/3, every single day, as people recovered, the virus kept a constant amount of people infected.
We are
and
now having
that even
40+
increased.
thousand new cases a day.
Hold on.
I would not be surprised if we go up.
Sorry about that.
to
We've got
100,000
Dr.
a
Fauci
day
talking.
If this does not turn around.
One of the nation's top doctors
Yeah,
warns
it
how
loves to
coronavirus
play
cases
even
could
though,
grow.
yeah, there you go. It loves to play even though I had it on pause. So anyway, going back to what I was saying. So where are we? So we go back to 6/3. So again, the virus never went anywhere. We all kind of knew that, we were kind of hoping or whatever, but that steady progress, again, you just have to see that the progress of the virus was always steady. Even when we were quarantined at home, it just kept it low, and that was very successful. But every single day between 5/11 and 6/3, the virus kept everybody at a same number infected, plus it increased slightly. Okay, so let's drop that real quick. and go to, hold on, we have TMC stats. Let's see. And then when we opened up, okay, so I wanted to make a point here real quick that the U.S. daily total for July 2nd was 55,220 people infected. Okay, so that's another record. Texas, now I have only July 1st because we haven't reported for July 2nd yet that I can find, was 8,029 people infected in the state of Texas, new infections. That is a second consecutive day record, according to the Houston Chronicle, published on July 1st. So let's just say it was 7,000 something, because I think it was. That's 15,000 people in 2 days, all across the state of Texas, and everybody's got their different different counties are leading and whatnot. But let's look at something real quick. So I'm going back here. This is the TMC chart that I started off with last time. I'm going to do a small magnification so that you can read this. Okay, so this was on 627 that I got this right up there. Okay, so what do we have? We have 31% and 97% in phase 1. And remember, he said that we could easily move into phase 2 and take a whole bunch of people, and he was talking about hundreds of beds available. But I want you to take note here that phase 2 already has 24% COVID positive patients in there, and it's at 72% capacity, and also 56% respectively for phase 3. So I'm not understanding how we have a whole lot of beds, okay? But then again, TMC Medical Center is running itself. Okay, so let's pop up here and go to July 1st, okay? We'll just skip over. I only had 3 slides. I've only been tracking that since I found out about it, okay? So now look, we're up to 38%. That's a 7% increase, and they're now full. So that's 3% they went up. They're now completely full. I think we went up about 7 or 8% there, and now they're at 79, and 23, and 61. So 79%, that is, that's a lot. That's right at 80%. You got 20% left, and here they got about 39% left. But the issue is, this is as of 7/2. Now, that article that I cited from NBC, or that news story, it's called "Internal Messages Reveal Crisis at Houston Hospitals as Coronavirus Cases Surge." I will be doing a report on that one later. According to that, they've been moving patients around. MD Anderson is taking patients now. Texas Children's been taking COVID adult patients. They're moving people around, moving them out to different hospitals. These numbers should be more steady than this. With them converting more beds, moving people out, moving them to other places, these numbers shouldn't really be going up, but they are, 7 and 8%. If this holds, even with the current rate, because the rate is increasing, the infection rate is increasing every day, how can these numbers possibly hold? I mean, again, we have those diametrically opposed statements of, we're doing okay, we'll be okay for 2 weeks, and then the other Methodist official that said, like, I'm worried about next week. This week, I think we can handle it and whatever. So what I'm trying to say is there is less logic and more hopefulness going on. We have to all stay as safe as we can, because the hospital system is not able to handle this surge that's coming. And there's also been a comparison to us to New York in the early stages, which I think is appropriate but scary. But the fact of the matter is, there's something else I'm going to be touching on later. Even those people who have mild cases of the coronavirus, they're referred to as long haulers. There's thousands of them, thousands and thousands, and some of them who got the coronavirus and had mild cases. And, mild, they didn't have to be put on oxygen or a ventilator or anything like that. They and were infected in early or mid-March. They're still sick, even though they have technically recovered. Here, as of June and July, they are still sick. There's actually, I'm going to cover this in another segment, but there's actually one individual, she's a nurse, and she hasn't been able to return to work because she's been running a fever for 90 days. And that's because she's recovered. So it's plenty of other stuff to go into. Leave your comments, questions, anything like that. Please do your own research. Follow up on these stories. I'll try to put links in the comments. And just, stay safe, and please stay informed. Don't take some of this information that's out there. In my opinion, this part is purely my opinion, but I think they're trying to make sure that we don't get panicked. And which, nobody's advocating panicking, but to be lulled into a false sense of security is just as bad. All right, so for coronavirus reality check here, I'm Jason, and we will see you next time.